Thanks, Joe. Good evening, everyone, and thank you for joining me tonight. I'm Congressman Rick Larsen, and I represent the beautiful 2nd Congressional District. I'm here in Everett tonight for this call. The district, as you might know, goes from Mount Lake Terrace to Bellingham and includes all of Island and San Juan counties as well. So tonight's town hall here's how it's going to play out a little bit. I'm going to give an update on the COVID-19 response. And then I've asked Dr. Paul Pottinger of the University of Washington on the call to talk a little bit about the virus and the public health and healthcare response and a few other things related to public health. So we'll take your questions and comments for about an hour after we're done with presentations. As Joe mentioned, if you have any questions tonight, please press *3 on your keypad or type them below the streaming player. So the federal government, the state of Washington, and local health departments are taking COVID-19 very seriously. I want to encourage everyone to do the same. Tonight, Governor Inslee issued a statewide stay-at-home order to help mitigate the spread of COVID-19. As we learn more details about the timing, duration, enforcement, and exceptions, please stay at home and stay healthy, as the governor pointed out. If unchecked, the spread of COVID-19 does threaten to overwhelm our medical resources. So some shared sacrifice, as difficult as it is necessary to protect our neighbors and yourself from this serious disease. Stay at home will also lead to economic hardship, and I'm working in Congress on more economic help for workers, small business owners, and others who have lost jobs or lost hours as part of that fight against the spread of COVID-19. Washingtonians, we must continue to follow recommended science-based precautions. Wash your hands, stay at home if you're sick, call the doctor if you're feeling well, and practice proper physical distancing 6 feet or more. I want to give an update on personal protective equipment. This is the #1 issue I hear from people. The existing supply does not yet meet the current demand locally or nationally. I'm working with members of the delegation in Congress and Governor Inslee to continue to communicate our state's need for personal protective equipment to the federal government. This past weekend, Washington State received multiple shipments of PPE, or personal protective equipment, from the Strategic National Stockpile. It only fulfills Washington's first request, and we will need more. The distribution of the PPE will prioritize healthcare professionals who are working with people with known exposure risk, meaning those healthcare professionals and first responders working with patients already diagnosed with COVID-19. From there, the state makes decisions on the need to distribute according to what is best for the overall public health interest. Some local manufacturers have reached out to our office and to Washington State government to volunteer their manufacturing facilities, and we welcome that, and we would direct anybody who does want to volunteer their manufacturing facility, direct them to the governor's office for coordination in their response. At the federal level, the Defense Production Act is one tool for helping to meet the growing national and local demand for products like PPE and ventilators and masks, but we cannot wait for it to get up and going. The Department of Defense is providing 5 million respirators and 2,000 ventilators for the COVID-19 response nationally. These supplies will go to the Strategic National Stockpile, and FEMA, the Federal Emergency Management Agency, will distribute those supplies. The Department of Defense also is offered to deploy 5 field hospitals nationally. We anticipate we will get at least 1 field hospital in Washington State. These field hospitals will include beds and equipment, and we hope medical professionals. This is different than the field hospitals being provided to Seattle by the Department of Health and Human Services. On March 18th, the President issued an executive order directing the Department of Health and Human Services to rate contracts and orders and make allocations of emergency medical supplies for COVID-19 response. The Army Corps of Engineers is working on converting existing buildings to hospitals in 4 phases, identifying a site, which would be our state's responsibility if we chose this route. The Corps of Engineers, with the help of the Federal Emergency Management Agency help, would then reconfigure the building based on the need, and then the Federal Emergency Management Agency would provide medical equipment and supplies, and the state would be responsible for populating that is, bringing in medical professionals. So that's how that process would work. On the test issues, and we're going to hear more about this from Dr. Pottinger from the University of Washington, more tests mean better knowledge and therefore smarter actions to stop the spread. As of this morning, more than 30,000 people in our state have been tested. Approximately 2,000 of that 30,000 plus have COVID-19. The test evaluated per day has increased from under 1,000 a day to about 3,800 a day over the last couple of days. So more tests are being done and more tests are being evaluated. Doctors are being asked to prioritize people with symptoms and those who work in places like hospitals, long-term care facilities, and public safety. So our priorities are more testing and faster testing. And again, we will have a little bit more on that from Dr. Pottinger. On small businesses, another set of issues I hear about after PPE and after tests, help for small businesses. Small business loans can help some small businesses, and there is availability through the SBA Small Business Administration for low-interest loans as a result of COVID-19 closures. But plenty are still hurting because these loans are not always the right fit for every small business. So up to $5 million of the governor's strategic reserve funds are available as small grants to small businesses across the state to help prevent closure due to COVID-19. And the state's Department of Commerce at commerce.wa.gov is coordinating the application process for that. Certainly, we've seen thousands of our neighbors thrown out of work as a result of COVID-19 closures. Unemployment benefits are right for you if you lost your job, your employer is temporarily closed to comply with state guidelines, or you were temporarily laid off. The unemployment filing process includes basic eligibility. It includes when you apply, you have to have your personal information handy, like a social security number and contact information, and employer information. You can apply by phone or online. Online will be faster given the high volume of calls they are getting at the Department of Employment Security. And there is an application checklist, and I would recommend that you go to the Employment Security Department's website at esd.wa.gov. I do want to touch on FEMA. There was a national emergency declaration where Washington State was recently notified by the Federal Emergency Management Agency of their request for a major disaster declaration. That was granted, but what does that mean? It opens up federal funds in Washington State for individual assistance to households and public assistance. As of right now, Washington State is approved for crisis counseling, but FEMA is continuing to evaluate the situation and considering further relief, such as disaster unemployment assistance. So that declaration was just a start, and the congressional delegation, including myself as a member of Congress, will continue pressing FEMA to expand the disaster declaration for Washington State to include individual assistance, public assistance, hazard mitigation assistance. Individuals may apply for assistance by going to disasterassistance.gov or by downloading the FEMA application on their smartphone at www.fema.gov, or through I'll leave it at that. Individuals who are deaf or hard of hearing or have a speech disability, for those who can help are on the phone and help people on that, for the call 800-462-7585, and individuals who use 711 or video relay service may call 800-621-3362. We'll have all those phone numbers up on my website, Representative Rick Larsen website. I do want to talk about some things in the news. Economic disaster relief. In Washington, D.C., we are trying to put together an economic disaster relief package. I am seeking to include assistance for aviation and aerospace manufacturing, which would include a package that would prevent employee layoffs, protect workers' salaries and benefits, guarantee paid sick leave, prohibit executive bonuses, stock buybacks, or dividends until taxpayers are paid back, and to ensure full transparency and federal oversight. Regarding a question I get, especially in the last couple of days, about Boeing, I represent about 20,000 women and men who work at Boeing, and there's an additional 10,000 or so that go to work there every day at the Everett plant. And yesterday, a Boeing Everett plant employee died from coronavirus. Boeing this morning announced that all of their Puget Sound facilities will start reducing production activity today, and on Wednesday, March 25th, Boeing Puget Sound facilities will suspend operations. They anticipate that suspension will last 14 days, and employees who cannot telework, and this would be most of the women and men who work on the line, employees who cannot telework will receive paid leave for 10 days of the suspension, essentially every working day but weekends, with the ability to take paid time off, vacation, or sick time thereafter. I am working to get clarity from Boeing on the way the company plans to keep employees safe. I'd also note on public transit, another issue that comes up, I support relief to transit agencies to support their operating budgets, protect drivers, operators, and passengers. And before I turn it over to Dr. Paul Pottinger, I do want to say especially to health workers who are on the line, to those working in hospitals, the nurses, the physicians, the women and men in janitorial, the ones who are working at senior centers or convalescent centers, as well, to our first responders and emergency medical service providers. I am working to be sure that you can get your your personal protective equipment as soon as possible. I know it's not enough, and I'm working tirelessly along with the rest of the congressional delegation to get that supply to meet the demand in your workplace. And I want to be really clear about that. So it's hard to ask you to bear with us, but we're doing our best, and but we can do better on your behalf. I now want to take an opportunity to turn this over to Dr. Paul Pottinger for some comments. I know many of you have concerns and questions which require medical expertise. For that reason, I asked Dr. Pottinger, who's the director of the Infectious Diseases and Tropical Medicine Clinic at the University of Washington Medical Center, to join us tonight. Now, he's going to provide about 5 minutes of comments. I have a question for him when he's done, and then I'll turn it back over to Joe. So if you'll just bear with us for a few more minutes to hear from Dr. Pottinger, and then we'll go to the questions. Thank you. Dr. Pottinger, go ahead.
Hey, thank you so much. Thanks to Congressman Larsen for setting this up. I appreciate your leadership in setting up this kind of a town hall. I think people have questions, and rightly so. So any chance that we in the infectious disease medicine community have to talk with folks about their concerns, I really welcome it. Yeah, I don't have a lot to say in terms of a preamble. I want to get to question and answer. My overall role, I'll tell you a little bit about myself, and then we can get to that. But yeah, I am a doctor here at UW Medical Center, the Montlake campus. My job is to have the back, to have the support for all of our healthcare workers here, doctors, nurses, pharmacists, everybody, to make sure that they have the safest working environment possible and that they have the best information and technology to take care of our patients. It's still early days with the epidemic, believe it or not. It feels like it's been going on forever. There's still a lot we have to learn about the coronavirus and the way that it is spreading in our community, in our hospitals, etc. We are committed to finding the answers to those big, important questions. I am more confident and optimistic about our situation, actually, than I've been through the entire epidemic. I think things can work out for us as a society if we play by the rules, and I'm happy to talk about details of that if there are questions that folks have. So I would say, yes, our goal at UW is the same as the goals for all the other doctors, nurses, and frontline healthcare workers across the state, to keep people healthy. I want to emphasize, we do not have the traditional countermeasures that we want. We do not have a vaccine. We do not even have a proven treatment, an antiviral treatment for this infection. We have experimental treatments here at UW. We are working on trials for experimental treatments for these patients who are very, very sick with this condition. And so we are working hard to make sure that if you come to our hospital, we will take great care of you. We would really prefer that we can take care of you at home by telephone, through telehealth, etc. We can talk about that as well. This is a virus that I think everybody understands is very similar to viruses that we've known about for a long time. We do have experience with coronavirus infections. This one is just more catchy and more difficult for us to deal with in a minority of cases. Most folks just get a cold. Most folks just get a case of what feels like a bad flu. And yet some people, a small minority, especially those over the age of 60 or 70, and especially those with a weak immune system, they are at higher risk. Not guaranteed, but they're at higher risk for having a bad outcome and very severe disease. And that is why it's so important that we all play our part and abide by the rules from public health and from our government to try to reduce the chance of spreading this infection around. So having said so, that was my quick preamble. Yes, I'm happy to take questions, and Representative Larsen, if you have the first question, I'd be happy to take that too.
Yeah, I do have a question, and this has to do with testing. The Food and Drug Administration announced this weekend that they've approved a test that where you can get results within 45 minutes. Can you address that particular test, and can you talk about how it might be deployed and why that's important versus a 24-hour turnaround or a 48-hour turnaround?
Yeah, thanks so much. So let me, I'm happy to talk about that. Folks, don't be confused. There's two different kinds of tests, generally speaking, two different kinds of tests for any viral infection. The first is what we would call a molecular test, or sometimes called a DNA-based test. Actually, coronavirus is made out of RNA, but it's a molecular test. We're looking for the virus itself. And sometimes you'll hear that called a PCR test. That is exactly the test Representative Larsen is talking about. We're lucky here in Washington State to have real leadership through UW, in fact, as it happens, and through our State Department of Health. We have excellent testing capacity using the PCR assay, looking for the virus itself. What we do is we swab someone's nose, usually the nose, often the back of the nose, and then we send that swab to the lab, and it is analyzed to see if we can find the molecular signature, the blueprint for that virus. If we find that using a machine, then we know that it came from that person's nose. They have this virus. So that is done traditionally in a standard laboratory, a very handcrafted and slow process. Sometimes slower than others. Actually, currently at my hospital, we can get that turned around in about a day, sometimes same day. So we're really proud of that. We're happy about it, but it still requires a lot of handcrafted work. The test that Representative Larsen is talking about is a little bit different. It's the same technology, but it is a platform that looks, it looks like one of those coffee pod things. Some of you may have a coffee pod at home, like a Nespresso. It kind of looks like that. The snot that comes out of that patient, it doesn't go into a large lab. It goes into a small container, and it looks like a coffee pod, and then it goes into a machine. Somebody pushes the power button, and they wait. And 45 minutes later, just as he said, that result should come back. This is a platform that we use today. It is standard operating procedure for looking for other viral infections, like influenza, respiratory syncytial virus, RSV, etc. So we've been using it for years. We like it a lot, and it's a commercial product that we do deploy because it has that fast turnaround time. Now that we know that this is now coming online for the coronavirus, no surprise, we've been waiting for this for weeks, so I'm delighted to hear that that's been approved. It's great news because in theoretically, it means that we could get a really quick turnaround time. You could go in to see your healthcare provider if you need to be tested because you're feeling very sick or you are at risk for severe complications, you should, in theory, be able to get that answer within one same doctor's visit. It's very exciting to us. So I like this technology, and we really do welcome it. I would emphasize there are still issues with getting that test done. It's still an expensive platform. That platform is not something that every doctor's office operates. There still is a lot of quality control and quality assurance that goes around using these platforms. So it is not something that every doctor's office can offer. At the moment, in fact, the number of these machines is not big enough to support that statewide. But it is a good step in the right direction. And it's my hope that if the manufacturer can really ramp up their supply of the test kits, not the test kits you've heard about from before, the ones that went wrong from CDC, not like that, but just the supplies, the coffee pods, if you will. And if we can get enough of those machines out there, it means that we could get a faster turnaround. I think there's real advantage to knowing quickly whether someone has an infection or not. It simplifies your planning for what you're going to do in your family structure, what your options are for your next level of medical care, etc. So testing is good and fast testing is better, and I certainly welcome it. It's not going to be the one thing that turns the tide on this epidemic. That's still social distancing, but I think it can be part of the solution.
Great. Thank you very much, Dr. Pottinger. And Dr. Pottinger is going to stay on the line, folks, if you have questions for him, and I may turn to him as well. Joe, I'll turn it back over to you.
Yes, Congressman, thank you so much. Thank you, Dr. Pottinger. All right, everybody on the phone, I know folks have been pressing *3, but I just want to invite you again to press *3 at any time. If you have a question or you can also press the number 1 to sign up for Congressman Larsen's e-newsletter, which is a great way to stay informed as the COVID-19 situation evolves. And I also want to encourage everyone to follow Congressman Larsen on Facebook, on Twitter, and on Instagram as well. And with that, Congressman Larsen is ready to take the first question. I think what we're going to do first is take a question from Erwin. Erwin is on the line, and he has a question about accelerated testing. And Erwin, you are live.
Hi, am I live? So here's
You're on, Erwin.
All right, thanks. I understand that a small city in Italy did blanket testing for 3,300 residents. They stopped the entire spread in that city by simply testing and getting the results back. With the question that you asked about the accelerated test that gives 45 minutes with the results, how can you help, or how soon can Washington State get to the point of blanket testing? Because if we know, we can certainly stop people from being in contact with people, and those who are not positive can start slowly lifting restrictions and going back and getting that economy back to normal. Now, this would take, obviously, time. We're looking at maybe 3, 4, 5 weeks before we can start getting things back to normal. But it would be sooner than what we're doing with this throwing things at the wall chance of this. We need to know where we are and who needs to be restricted. The other thing is, Rick, I understand I've been watching what's going on in Congress. Hopefully, we can get a legislation done that will also suspend mortgage payments for several months and listed 30 days after we start returning to normal, and things like rent and well, it's this money. We got to get people spending money at some point here in the future, and we need to reduce their outgoes of money. I realize this is a big deal, but we need those two things: blanket testing and economic help for those who need it.
Yeah, good. Thank you very much, Dr. Pottinger. Do you want to take the accelerated testing question, like the value of if it can work, and does it help us get back to normal faster?
Yeah, thank you. I think it's a great question, and my dream would be to know the viral infection status of everybody. If I had my magic wand, there's one thing I could do would be to say who's got it. Because if we knew who had the infection, we could really focus on that smaller group of people and say, hey, you really do need to do your social distancing. We're going to take care of you. We want you to stay out of society for the moment, and everybody else could get back to normal. I mean, that's the dream. The challenge for us, of course, is that technology is not yet there on a large enough scale for us to deploy it statewide, region-wide. I like the example you made, which was if we had a smaller village, 3,000 people, little town, you could definitely imagine going on a town-by-town basis and doing this, and that could work. It would just depend on nobody coming or going from that town, right? Because as soon as someone who's not screened, who doesn't know their status, comes into that group of tested people, that's how the infection takes off again. So at the moment, it's a pretty dull instrument that we're using. I would say this is, in fact, unprecedented in my lifetime. I'm 51 years old. Never been anything like this in my lifetime. And I would say here in Washington State, I don't think we've had this for 100 years, since the 1918 influenza, where we are so broad in our general approach to this. And I would emphasize, I do like the idea of that kind of targeted testing. It's really difficult for us to understand how we would actually operationalize it in the real world. But maybe as that technology gets better, it may become something that we can do. In the meantime, out of desperation, because we feel we have no other real choice, to protect ourselves, to protect our seniors, to protect each other, this is this very, very broad approach that we're using. And folks, I got to tell you, it's hard. It does seem to be working. It's early days. We do not yet have a full idea of the epidemic curve. I think at the moment the epidemic is tolerable from the perspective of our healthcare system. The question is what you said, how do we get out of this hole that we dug for ourselves, and what's going to be our chance to fire up that economic engine again? For that, I need the expertise of our friend, the Congressman here, and I'll hand off to him.
Yeah, thanks. And not to be an expert in healthcare medicine, but I'm not, but it sure sounds like based on the Erwin's question and your answer with regards to accelerated testing, you still need social distancing. You still need to be sure that once you test, that you yourself then stay free, if you will, of someone who might be a potential have COVID-19 and give it to you even though you've already been tested. So that social distancing is still an important part of whatever we do here. On the second part with Erwin's question, you are right about mortgages and rent payments and business loans and things, and some of that is regulated at the state level in terms of being able to make the decision about paying mortgages and such. Like, for instance, Governor Inslee has issued a 30-day moratorium on evictions. At the federal level, there is a moratorium on evictions for people who have mortgages backed by the federal housing agency, just as a for instance. But we need to be sure that there is money in the pockets of folks. And the House of Representatives majority today did introduce a bill that's a $2.5 trillion bill that would not just continue to pay for testing and for the evaluation of the test, but also would pay for eliminate cost sharing for coronavirus treatments as well. It would protect frontline response workers by implementing clear infectious disease protocols. It put money in the pockets of individuals and families with direct cash infusions. We are going to create a temporary federal pandemic unemployment compensation of $600 a week for any worker affected by COVID-19 and eligible for unemployment compensation. And that's combined with existing benefits, what we've already done. We're expanding paid leave and medical leave, something that we started in the previous coronavirus package. We are working on doing interest-free loans to support small businesses, something that I have promoted, with some forgivable components to those interest-free loans as well to help Main Street businesses, and dollars to assist our state and local governments to stabilize their finances as well. There's a few other things too. Separately, I'll get ready for the next question, Joe, but separately for Erwin, I am looking at what we can do federally on mortgage payments, on rental payments, on business loans as well. I don't have the answer tonight, but I'm still looking at that point too. Joe?
Sir, yes, we're going to take a question from online, and I'll read that question. It's from Paul Sherman. This is a question we've heard from a lot of people. How can we help from home during the COVID-19 outbreak?
That's an excellent question, and this is Rick Larsen. What I've been telling folks is the first thing you can do is stay home and stay healthy, as Governor Inslee noted tonight in his statewide message. Obviously, not everyone is going to be able to stay home, even if you are staying home because your employer isn't open right now. You're still going to have to go out. You're still going to have to take some self-care time just to go on a walk. But as best you can, social distancing is extremely important. The second thing, and after the governor's announcement, I'm a little reluctant to point this out, but there are people in our community who rely on the social safety net, like our food banks. And our food bank volunteers are largely people who are 60 years or older. Some of them have underlying medical conditions. Those are the volunteers at our food banks. But food from food banks still needs to get out to people. And so I'm not trying to counter the governor. I am just suggesting that calling your local food bank to see if there's an opportunity for you to help them pack boxes of food for people that they deliver, so long as they're practicing good public health social distancing in the food bank, might be something that if you're able and you're healthy, you might be able to do. And also looking at some of those other volunteer opportunities, always, though, keeping in mind the social distancing aspect of that. So you even have food banks who are changing how they're distributing food, and they're changing how they are putting their food packages together for people, because they need to ensure that even their volunteers are practicing social distancing while they're volunteering. So there are some things you can do. I'm, again, not trying to counter the governor. It's just the social safety net still has to run for people who maybe don't have money to go to the grocery store or have to have food bank food to supplement what they do get at a grocery store. So think about those kinds of things, always keeping in mind public health aspects and social distancing. Joe?
Yes, sir. The next question will come from Joseph Petros. He wants to talk about employment aid passed in the recent House package. So, Joseph, you are live.
Okay. Is it? Can I be heard?
Yes, you're alive. Go.
Okay. Thank you. I just have two quick questions. One for the doctor and one for Congressman Larsen. For Congressman, about the employment assistance. I know from the Congress, we on the media, we were told this is not an employment assistant, but it is going to be employment assistant. I just will give you an example. I have a family member who works with a private school, and they were just told, don't come as of Monday. 2 weeks ago. So we don't know whether he would be eligible for unemployment or whether the school would be subsidized or get assistance. So what do we expect?
Okay.
And the second quick one is for doctor. The PCR test, as I heard earlier, is effectively being used at UW. So is this, as of now, do we have those kind of tests, the one with a one-day return, only at UW, or do other carriers or hospitals, like let's say Providence or Swedish, have at their health centers?
Great set of questions, Joseph. This is Rick Larsen. Let me answer the first one. I don't want to give you bad information, so for anyone who has questions about unemployment assistance right now, that is available before Congress adds to unemployment assistance. I strongly encourage your family member to go to esd.wa.gov. There is a COVID-19 scenarios and benefits available, a page that outlines 11 different situations where someone might be, 12 different situations where someone might be unemployed, and then list the kind of assistance that might be available given that person's individual scenario. So again, I'll emphasize esd.wa.gov and look for the COVID-19 scenarios and benefits available. That's what you can do now while Congress continues to work towards doing a larger package to support workers and families. Dr. Pottinger, can you address the availability of testing at other labs and hospitals?
Yeah, no problem. Yes, the answer is yes. You can definitely get very accurate, reliable, and fast turnaround for the molecular test I was talking about, not only at UW, but at most any health center that you go to. By the way, they may send it to our lab, or they may send it to the Washington State Department of Health lab, also very excellent and also very fast turnaround. At the moment, we think we do have, yes, good access to testing. It was a difficult start with our capacity. That capacity is up and running both at the state and at the UW, and whatever healthcare center you go to will almost certainly use one of those two here in Washington State.
Just to follow up, Dr. Pottinger, are the LabCorp and Quest, the two private lab companies, doing a test evaluation in our state as well?
Yes, I believe they are. Thank you. So those are good and also reliable labs. I don't have anything against them. I'm not as clear on their turnaround time, the delay in getting the results, only because I just don't have personal experience with them. If your setup happens to use them, I think that would be great. You might check with your healthcare provider to find out what kind of turnaround time they are seeing. Frankly, whatever answer we give you today may be different tomorrow. It's a very dynamic situation. But overall, the testing is very accurate and very available as well.
All right. Thank you. Joe?
Excellent. Next up, sir, this is no relation, but we have Mary Larsen. She has a question about independent contractors. She is a massage therapist. Mary, you are live.
Hi. Thank you so much for having this. Appreciate it. So I'm a licensed massage therapist here in Washington State, and I am presently not working, of course. I can't work, but I'm also working under a fitness club that is closed as well. So I am an independent contractor and wondering if any of these relief funds will take care of massage therapists.
Yeah. Thanks, Mary. I can confirm that she is not related. I don't have any relatives named Mary Larsen. So for everyone else out there listening, I'm not picking family members. Are you an ON?
Anyway. Yes, I'm an ON.
Well, see, we're definitely not related, just to assure everybody. So right now, Mary, for independent contractors and for self-employed folks, we are having difficulty finding out where you all fit in to the assistance that is available. But we will find out. One of the things we're looking at is the disaster unemployment assistance that could be available under the FEMA disaster declaration. So right now, as you're aware, to have unemployment assistance, you have to be unemployment compensation. You have to be paying into unemployment comp. But a lot of self-employed folks and independent contractors don't do that, so they're not eligible. But because we have now this FEMA disaster declaration, we're working with FEMA and the state to try to expand what that means for our state. And it's very possible that the best resource for help would be disaster unemployment assistance, or what we call DUA. And we are working with FEMA to explain to them why we need to expand our emergency declaration. Because we're a state that has a lot of gig economy workers, a lot of part-time workers, and a lot of small businesses and independent contractors like yourself. And that category of worker just doesn't fit into some of the traditional buckets of help. So I want to let you know that, one, right now, I don't think there's specific help for you. I would say, though, we are trying to work with we are working with the state and FEMA to expand the disaster declaration so that we can include self-employed and independent contractors.
Right. Next question. I want to thank everyone for your patience on the line. We've had over 2,700 participants on the line and over 8,000 people tonight, so that's incredible, and thank you for joining us. The next question we're going to take is from Shirley Morrow. She's concerned about a lack of services in Island County, particularly transportation and medical services. So, Shirley, you are live for your question.
Thank you, Joe, and I really appreciate Rick Larsen doing this. I became aware that Island County has 83,000 residents and not as much medical backup as would be needed in this situation, and I wondered what could be done about that. I know that they're working hard in other areas, but that's something that not too many people have any control over. And if people are needing medical care, what will happen?
Yeah, great. Thanks, Shirley, for the question. Yeah, there's a big difference between providing health in Seattle or King County, or even Snohomish County and Everett, where I am, and providing it on Whidbey Island or San Juan Islands or even Whatcom, or I was in Cedar Woolley today. And I think it underscores a lot of the issues that we are trying to sort out by ensuring that some of our lower populated areas, when they get 25 cases, I think like they have in Island County, having 25 cases in Island County it may not be a lot for King County, but it is a puts major pressure on the healthcare network. And so, we stand ready to help Island County and Whidbey General Hospital. One of the things we're doing is working on a waiver from the Medicare rules for Whidbey General that would allow Whidbey General to use telemedicine, and get reimbursed by Medicare for that. So a person wouldn't necessarily need to go to the hospital for their appointment or to their physician. If you lived in Island County and were seeing a physician in Island County, you could do that through the use of the internet if you have that capability. A lot of people do, some people don't, and I understand that. But the challenge is that Medicare doesn't reimburse that. There is a waiver now from Medicare to reimburse telemedicine and telehealth for some certain kinds of hospitals, but not hospitals that are also rural health centers under federal designation like Whidbey General. So we're trying to get a waiver now to include Whidbey General. So that would, for some people, maybe not in your case, Shirley, that would resolve some of the transportation and healthcare access for folks. The other thing I know some transit agencies are doing are prioritizing their paratransit services for people who are going to medical appointments, as opposed to just doing a first come, first serve if you want to go shopping or if you want to go visit friends or something. I know a few of the transit agencies are prioritizing their paratransit service for people who are going to a medical appointment. So I'd recommend calling Island Transit maybe tomorrow, or if you have internet access, going online to Island Transit to see what they say, and maybe calling them tomorrow to scope out what they could be able to provide to you in terms of transportation. We're really trying to be creative in our more rural areas, and telehealth is one way. Our transit agencies stepping in is another way to, and prioritizing is another way to help out as well. But we also have just the underlying challenges that are still there in our rural areas, like lack of providers and so on. So that's what I can offer. Dr. Pottinger, you've been in this business for a while. Do you have quite some insight into rural health, or what's maybe what the University of Washington is maybe doing to alleviate that burden?
Yeah, thank you so much. So in my day job, before we had this crazy coronavirus, that's a big part of what we do here for me, which is called antimicrobial stewardship. We're working with the critical access hospitals statewide to make sure that they've got all the latest information about antibiotics, how to use them, how to avoid them, etc. It's all done through telehealth. That's called Project Echo. We do have a large telehealth system through Project Echo that works with partners statewide, including in your district for sure. And so one thing that the university can do is to reach out to other healthcare providers directly and make sure they've got access to the best information that they need, all by computer or using a Zoom-type platform. There's also our direct patient care activities. That's also part of telehealth. We really think that if somebody has a question for us and we know that person, they're part of our medical family, we're their medical home, let's talk on the phone or let's talk by Zoom and have a conversation. We may be able to handle a lot of those questions without having you come down to Seattle and see us. It makes me sad because that's the favorite part of my job is getting to see patients face to face. But it's desperate times. It's time to be nimble, to adapt. We are making that change as well. It's been a huge change for us at our university. We're still catching up. If you are a UW Medicine patient and you're having trouble getting a hold of us through telehealth, please bear with us. We are working hard to make that go. But I think you're going to see this, not just at UW. This is a new opportunity for all of us statewide. Talk with your healthcare provider. Would you be willing to see me by telephone instead of having me come in and see you? That can work as well, rural areas as much as in urban areas.
Yeah, thanks. And Joe, get ready for the next one. I just would note that UW Medicine serves the San Juan Islands as well now, and so it's certainly a reality in my district that UW Medicine is providing the health care, but also the use of telehealth is critical to rural areas, and UW Medicine can fulfill a role there.
Yes, absolutely.
Yeah. Joe?
Absolutely. Sir, we have Eileen Pica on the phone. She's 83, does not have a lot of health issues, but she's been traveling, and she wants to know if she socially distances, is she allowed to walk? But first, I'll let Eileen ask her question. Eileen, you are live.
Yes, my important question is, at my age, we've been told by my doctor to go out and walk every day with social distancing, and I don't know whether at my age I should still be doing that because I am in the higher risk, I'm one of the higher risk people. So do I continue to go out when the weather's good and go walking or not with the coronavirus here?
Yeah, thanks. Thanks, Eileen. This is Rick Larsen. Kind of an easy answer, and I hate to put it this way, but take the advice of your healthcare professional on this one. I think that it is going to be important generally for everybody to consider the best balance between staying at home, right, and then taking a walk. Even Governor Inslee suggested today that taking a walk is a good thing, getting out, getting some air, but practicing that social distancing. You know, it's like walking. It'd be like walking with your friend, but you're going to be 6 feet apart, and at least 6 feet apart while you do that. So I know I took a walk last night, and I was fairly alone last night, but that's okay because I'm relatively healthy, and there was no one around to walk with. I wasn't walking with anyone. So I think what we've heard tonight from Governor Inslee on the stay-at-home order is to obviously, first and foremost, practice good social distancing, but there will be a time where you will be tired of being inside and maybe want to get out, but you also need to practice good public health when you're taking that walk as well. But ultimately, everybody, if you have a healthcare provider, take your healthcare provider's advice. He or she is the best one to provide you with advice on how to approach your own health.
Yeah, I agree, and just to add, to emphasize an agreement, number one, here's a direct quote from the statement from the governor. This does not mean you cannot go outdoors. If you feel like going for a walk or gardening or going for a bike ride, that's fine. Those are essential activities. Just practice good social distancing, at least 6 feet. So I love that he included that. It is so important. The reason they can say that medically is that the virus itself, let's say you're going for a walk and somebody who's sick and sneezing is going for a walk, that person should stay home. If you're symptomatic with a cold or a flu, please don't go outside. But you should rest assured that actually if people do, and you keep a berth of 6 feet from that person, your chance of catching this disease by breathing the air outdoors, extremely, extremely small. This is almost always spread inside, not outside. It's almost always spread by droplets from someone sneezing or coughing directly onto someone or onto something that they then touch. So I think it's great that at your age and any age that you're outdoors, I would encourage you to continue, as he says, in keeping with what your doctor has mentioned.
Yeah. Joe?
All right, next question is from Mike Perkins. Really good question. And Mike, I'll let you ask it about COVID-19.
Thank you for having me. My wife and I, we're kind of in that vulnerable section of society. We're over 60, and we have underlying medical issues. If we were to catch this virus and successfully go through it, become well again, can we catch it again?
Mike, that is a great question. I will give it over to Dr. Pottinger.
Yeah, thank you so much. This question has come up a bit, and you will see reports in the news media that some folks may have gotten COVID-19, gotten better, and then gotten sick again. The truth is, we do not think that is likely a thing. Here's the issue. The test that we have, that PCR test, is very, very sensitive. It doesn't miss much. So if somebody has the infection, they may shed small amounts of virus from their nose for a long period of time. The virus is probably dead. It probably is not infectious, but we can find it if we look for it with our test. So I do not think it's likely that people can get it more than once. I do think you could have COVID and then a flu, or COVID and then a cold due to rhinovirus. The symptoms are really similar, and so if you test somebody and they recently had COVID, you may find it again, but there might actually be another explanation for their second illness. We really feel that once someone has this, they're probably immune, and they're probably immune for life. Some of the listeners may ask a question about that. Can they be tested to see if they've ever had it? Yes, that's called a serology test. It's a blood test, and that'll answer this question for us. We don't currently have serology routinely available. We don't think it's a priority because that's more for epidemiology than it is to respond to the epidemic. But I appreciate your question a lot, and I think you should feel good that if somebody has gotten through it, they should be good for life.
All right, thank you.
All right, next question on the line is Jessica McKinnon. She has a question about foster care and what can be done so parents can have virtual visits. But Jessica, you are live.
Hi, thank you. We are foster parents, as was stated, and have had a terrible time getting the department to initiate remote visits instead of in-person visits, which we feel is not in line with what the governor is asking us to do and is putting our family at risk. We have a lot of young kids in the home and also take care of elderly parents, and so we're wondering what we can do to get that ball rolling.
Thanks, Jessica. I apologize. I did not have an answer for you on that, as most of that would be run out of the state. But what I can do is I've got my own staff is on the line tonight, and we can get that question and get you in touch with the person who can best answer that question. But it does underscore a pretty important point about social distancing. It doesn't mean staying away from people, because there are some people who do need attention, care, presence, presence, the presence of people, and we need to find ways to ensure that that can continue. So I'm very sympathetic to your question, and I want to have my staff get a hold of you. If you could be sure to email us at the rick.larsen@mail.house.gov, then we can follow up with you and connect you with someone at the state to get a good answer for you.
All right, just a reminder to everyone, if you do have any questions, again, press *3 at this time. We still have several people on the phone, and we thank you for being patient. We're trying to get to as many questions as possible. I do want to introduce Mark Johnson. You are on the line, concerned about not enough masks for essential workers. Mark, you are live.
So I have two questions, one for the doctor and one for Mr. Larsen. For the doctor, how long does the virus last on a metal surface, in the air of an indoor building, and or on a plastic surface? And with that in mind, Rick, the question I have for you is, being an essential worker, a state electrical inspector, I'm out in the field today talking to construction workers who are gravely concerned that they're being forgotten about as far as getting N95 masks. And then also, you know, being an electrical inspector, going into people's homes. I don't know what the environment is in that home, even though I ask, is anybody ill? There could be still something on a surface or in the air. So I'm wondering if there's any plan to get those masks out to the construction workers and even grocery clerks that are handling our food. A lot of the people are feeling like they're being forgotten.
Thanks. Doctor, you want to address the life of the virus?
Yeah, absolutely. I think it's a great question, and those two questions are really linked together. So the virus is spread through respiratory droplets. That's when somebody coughs or sneezes. Those little small, if you ever cough into the array of sunshine, you can see that little cloud of spit that comes out and then falls to the ground. So that's how the virus comes out of the mouth and the nose. When it lands on a surface, it is still a threat to someone who might touch it and then touch their own eyes or nose or mouth. But that time, the time that it remains a threat, it definitely varies. It's variable depending on a different bunch of factors. The surface, how porous the surface is it antibacterial? And also the environment. Is there ultraviolet light coming down from the sun? Actually, sunshine is pretty good for killing off the virus. We have information to answer your question. It's published in the New England Journal of Medicine just last week, where they did a bunch of experiments looking at this on a variety of surfaces. Copper, for example, I think about 3 hours it can survive on copper in this experiment. Stainless steel or plastic actually went out to several days. Cardboard, what you might get on a delivery box if you're getting home delivery, less than 24 hours. So the virus is not a threat after a period of time. That period of time varies depending on the surface. You asked about the air. I appreciate that a lot. If someone sneezes or coughs, those droplets by gravity will go straight to the ground and almost immediately fall. If there is a small amount of virus that stays in the air, that may linger in the air, assuming there's no air movement, just like a still piece of air in a still room, maybe for about a half hour. After that, it has fallen to the ground again by gravity. And so if you were in your line of work, I would say if you're coming into a household, I love what you're doing. Talk with the people, the customers you're seeing. Is anybody sick? And if they are, just ask to try to reschedule with them. Unless it's an absolutely urgent thing, you could try to reschedule with them later. If they say, look, I am sick, but I need you to turn on the power. You got to come in the house, help me out. That is okay too. I want you to keep at least 6 feet of distance away from those people, the homeowners. They got to trust you when you go to the panel, do your work. And I would say that when you're doing your work, if you've got a pair of work gloves, that is excellent to me. Regardless of whatever kind of gloves you may be wearing, do that hand hygiene. If you don't have access to soap and water in your work truck, that's fine. Use some alcohol-based hand rub. Alcohol hand rub like Purell, etc. It's very, very effective at killing this virus. This virus is not particularly hardy in the environment. It usually doesn't last more than a few hours on a surface, maybe a day at most in some cases, and it is also very well killed with the alcohol. You can do those things to protect yourself. Number one, screen at the door to make sure that you actually have to come in and do this work if somebody's symptomatic. Number two, if you do, keep them 6 feet away from you. Number three, good hand hygiene for yourself. Of all the things we just talked about, actually a mask is not really high on the menu, N95 or otherwise. If there's anybody in this scenario who would need a mask, it would be the person whose house you're going into who's coughing and sneezing. But for you yourself, probably less important because you're going to keep 6 feet away from that person. In my hospital, when we do health care with a sick patient, we do wear a mask. We protect our eyes and our hands, our whole body, because we're getting up right next to that patient. We're touching them. We're close to them. If you can stay farther away, the mask is really not an important feature, I think, for your self-protection in this era of social distancing. And Representative Larsen, if you want to add anything to that, I would welcome it.
Yeah, I'll just get to the on the construction worker side and some of the people that you're seeing on the work site. I think what Dr. Pottinger said at the end is extremely important. It's a matter of social distancing, and it might mean that the workplace and the work being done in the workplace needs to be reorganized, like some companies are doing, some manufacturers are doing, who will continue to be essential businesses. They're reorganizing their work site to keep people at least 6 feet away from each other. And I was just on a call today with many of the folks in the building trades, and they have a lot of priorities, including appropriate personal protective equipment. I would just note that from a prioritization perspective, the State Department of Health is prioritizing healthcare workers, emergency responders, first responders, long-term care workers, and others who come in direct contact with someone who is COVID-19 positive. So that's where the PPE is going to go first. So that's Tier 1. Tier 2 would be other emergency responders and first responders and other healthcare workers who are not coming into contact. They might have a different situation for whatever reason. And from a healthcare priority perspective, it's a tough message, but the construction work site isn't from a public health perspective, from the State Department of Health, that work site would not be on a priority list for PPE. So I'm only a messenger here, but I think that the best way to address that is through the Department of Health about priorities. But given the demand for personal protective equipment and the available supply, I think it is probably a wise, it's an informed public health decision that the Department of Health is making right now. So that may not be satisfactory, but that's the best description I can tell you of the current situation given supply and demand of PPE.
All right. Next question is going to be from Dr. Daphne Ryan. She's currently a military contractor, healthcare provider at Naval Air Station Whidbey Island. Dr. Ryan, you are live.
Yeah. Hi. Thanks, Rick, for all you've done in the past decade to get us to a place where we can address this well. So personally, thank you for everything you've done.
You're welcome.
We are, as a naval contractor, it's a private contract. Your work with the Armed Services Committee, China, and Aviation puts you in a unique position to address this issue. We are told we will not get paid if quarantined as healthcare workers and or we go to starboard port kind of systems. And that's for all the contractors, not just healthcare, but particularly healthcare. So I sent a letter to your office and just spoke with Katie, just some of the details. But if you can follow up on that, because should we apply for unemployment or hold on and let it work through the contract system? What would be your suggestion on that?
I'm not in the. Good to hear your voice again, Daphne. I'm not in the business of giving career advice though right now.
Sure.
You have to make your own assessment. I do know that one thing we're trying to do from the DoD perspective is to get the Department of Defense to accelerate their payments to contractors. So normally, if they have an accounts payable, they might do a 60 or 90 day. But we are trying to get the DoD to say, hey, look, if you know that you're going to have to pay that bill, accelerate the time frame you pay that, so you're paying your contractors sooner, sooner rather than later. You're not waiting that traditional 90 days, because the DoD, the Department of Defense, is not shutting down in any of this. They are going forward. They're still defending the country. The defense industrial base is still going to work and operate. That is the companies that have parts or pieces that help build ships, that help build airplanes.
Correct.
That's going to continue, as well as the support for the women and men in the military. So what we want to do first is try to accelerate the payments that normally go to contractors, so that we deal with this cash flow issue as soon as possible. In that sense, maybe then we delay. Yeah. Maybe in that sense, then we delay that decision that you might have to make, because it gets us to the other side, perhaps the other side of the COVID-19 problem.
Exactly. Well, and then just for some comfort care with anybody else who's listening, I know up in Bellingham in your district, a gentleman, Scott Jones, he develops military clothing. He's developed a pretty sealed mask that anybody can make from home. And if anyone's listening, you can look up Frontline Masks, and that'll be from our district, from Congressman Larsen's district. But he's worked with physicians, and so there's a seal to it, and you can use a vacuum cleaner bag. There's plenty of patterns out there, but just so you don't feel like you're let out there and kind of out to dry, there are some options, and we are thinking about people who aren't healthcare workers. At least in Island County, we are. I think all over the state we've pulled together pretty well. But that would be my one concern, if you can fast track that, because yeah, we're making adjustments, and I just want to put that on your radar.
Great, thanks a lot. Joe?
All right, next up is Diane Figaro. She's asking about where to get the best accurate information. Diane, you are live.
Hi, thank you. Thanks for taking my call. So
sure.
I was on the watching TV this afternoon, and I heard from the White House press conference today at 5 o'clock that we needed to get back to business. President Trump was recommending that we got business going again as soon as possible, and that the social distancing hopefully would end pretty soon. And then about an hour later, 6 o'clock, watched the press conference by Jay Inslee, in which he announced that we would be staying home to stay healthy for 2 weeks, which I really appreciated. So I guess what I'm wondering is what the president's statements were based on. Was it science? Was it safe for him to be saying that to his audience? And I feel like for those of us who are trying to follow the guidance of all of our leaders, and I felt like I was starting to see some unity, or maybe some messaging that was more consistent from the federal on down to the local level. At this point, I feel like there's been a 300 or 180 degree turnaround, and now I'm concerned whether I should be paying attention to the press conferences coming out of the White House at this time. And so that concerns me as a consumer, or as someone, a citizen, trying to follow social distancing that is very important, I feel, here in Washington State. Thank you for taking my question.
Yeah, thanks, Diane. And Dr. Pottinger, I'll take this one because here I want to be gracious, and I want to be nonpartisan here. I do think that the president says things that he would like to be true and aren't. I think he's getting a little bit ahead of his skis, a little bit over his skis on where we are in the Pacific Northwest when it comes to dealing with COVID-19. I know he quoted Idaho, or he cited Idaho and Nebraska as two states that seem to have this under control. Well, they might, but there aren't a lot of people in those states, and there's a lot of room in those states. We're not necessarily in that position in our state. So what I tell people is when in doubt, listen to the woman that has a stethoscope hanging from her neck. That is, go to the public health professional. Go to the healthcare professional for the best information. I would suggest, even though Governor Inslee is not a healthcare professional, that his talk tonight reflected the best public health advice. And I would note that our Washington State Department of Health, although it's under stress because of the great challenges from COVID-19, is one of the best, if not the best, State Department of Health and public health system of all the 50 states and 4 or 5 territories. So I would just suggest strongly that that no matter who's talking, that what I ultimately go to the Department of Health website, doh.wa.gov, for the best public health care advice. I even don't put out messages that says Rick Larsen says. We put out messages that say, hey, the State Department of Health says, because I'm not the expert, and I'm doing all I can to be sure that people are hearing from the experts and know where to go for expert advice. So that's how I think I approach that nicely. Dr. Pottinger, did you want to comment on that?
I have all kinds of thoughts, hopes, dreams, and fears, but no, I'll keep my yapper shut. I agree. That is the way to go, and we live in Washington State. We take for granted. We are so lucky to have such a science and health-focused governor and government here. A lot of states don't have that. So please use that resource and listen to your governor. I think it's exactly the way to go. Thank you.
Yeah, thanks. Joe, I don't know what time we have. Oh, we got some time. Go ahead.
We got about 15 minutes left, so we're going to take a question here. This is probably more for Dr. Pottinger. It's from Michael. He asked, Michael, I'll let you ask your question. Michael Morcade, you are live.
Yes, my question is, if a positive person was to sneeze or cough on a dog or cat, does that pet become a carrier, and for how long?
Thank you. What a great question. I love that. So this has been studied, and you look at a dog, or certainly some dogs with such a long nose. My God, how could they not get infected? It's interesting. This virus, it turns out, probably came to humans from other animals, but not, we think, dogs and cats. Dogs and cats do not seem to be getting sick with COVID infection. Now, the fur or the hair on that animal, that could be soiled with somebody's snot droplets, and like I mentioned before, within about a day, that should go away. The fur is pretty absorbent. It's not an easy way to pick it up from somebody. So you're going over to see a friend. Well, you shouldn't have done that. We're in social distancing, so it shouldn't be somebody else's dog. If you yourself are sick, are you going to make your pet sick? No, it does not seem to be the way. But I would say if you're the caretaker of that pet, make sure you stay that way. I would not share that duty with somebody else, just in case they pet the pet and pick it up on their hands and then spread it to themselves.
Yeah. This is Rick. I would suggest, too, if you have a cat that actually wants to be near people, then you have a very unique cat. Sorry, just a little humor there, lighten the load. Reminds me, though, Dr. Pottinger, could you be more clear about the question from earlier about how long the COVID-19 does exist on a surface?
Yeah, it depends on the surface. So if you got an absorbent surface like cardboard is basically pressed paper, that will probably only be infectious, potentially infectious, for about a day. If we're talking about a surface of plastic, smooth plastic, that may be contagious for up to 3 days. I am not aware of any reliable data that says that beyond 3 days, based on what we currently know, and it is an experimental time in the epidemic, but based on what we currently know, there's pretty much nothing that's going to be catchy a surface for beyond 3 days. If you're not sure whether the Lego bricks that just came in the mail to you are infectious or not, let them sit for 3 days and you are good to go with those Lego bricks.
All right, thanks. Joe?
Oh, sorry. We have Hans is on the line. He has a question about the availability of COVID-19 testing. Hans, you are live.
Hello?
Yeah, go ahead, Hans.
Yes. Hi. I'm in Bellingham, and I have a question about the availability of COVID testing. It's impossible to get a test here, and a friend of mine who finally did had to be admitted to the hospital and got one 6 days ago, and there's still no results. So any update on when there might be enough tests to go around?
I'll let Dr. Pottinger answer that after I give comments. I guess without, of course, violating your friend's healthcare privacy, I assume that you said they are hospitalized and they have been tested, but they don't have the result back yet. Is that the point? One of your points? Sorry, Hans, are you still there?
Sounds like they took them a long time to get tested and the results still isn't back. It's really discouraging, and so I'm glad that you mentioned this. That's news to me, different from what we were seeing down here. I do not know whether that relates to, you mentioned somebody had to be admitted to the hospital to get tested. That is not the goal. The goal is to make testing as easy to do as possible. The testing has to be done safely. I just tested a patient here in my office a couple hours ago, and I'm trained to do that. I have to get into my personal protective equipment, which involves hand hygiene and gown and gloves and a mask and eye protection, and I know what I'm doing, and I have someone there to help me take all that gear off to make sure I don't make a mistake. That's one of the barriers to the test. This is a potentially dangerous germ. That's why we care about it. Our healthcare worker safety comes first. It may be that in the healthcare system that your friend is going through, they're still gearing up to do that. So I really appreciate the question because it shows that testing is not just the test. I wish this was more clear with our friends from the other Washington. Testing is not just the test. There's the technology to run the test, but you got to get that specimen the right way from the right patient at the right time. It's a lot of logistics that goes into testing. So sometimes people wonder, why don't we just test everybody? Well, because it's a nose test and it makes people sneeze and cough, and that threatens the health of the person doing the test. So it's a little bit of a logistics to do it. We can do it. We are doing it here, and I'm hopeful that that will become more readily and rapidly available statewide. So I appreciate letting me know about Bellingham.
Yeah. Thanks. I'll just follow up on that, and Dr. Pottinger makes a good point about the logistics. There's the test that actually is taking the swab, and then you have to transport it. Then it has to be evaluated at a lab that has available space to evaluate. Positive, then there's the treatment regimen, which could be, if it's mild, stay home. If it's moderate or more severe, you might be hospitalized. So it's, and frankly, what we're finding is that there's in some respects, in some places, more capacity to evaluate tests, but there aren't enough tests to fill up all the capacity of evaluation. And in some places, there's not enough capacity to evaluate the tests but there are plenty of tests being done, and that describes maybe some other states. So it's just not. This is something that I guess from a non-healthcare professional and someone who's watching how we're trying to get the response in, we are. There's been a plan in place, a preparedness plan in place. It is being implemented, and like any preparedness plan that is in place, you start finding out your gaps once you start actually using it, as opposed to just practicing it with others. So, Joe, before we get to the next question, I have a Facebook question from Brenda Felder, and I just will let Brenda know. She asks, can you address the federal law that disqualifies students working fewer than 20 hours from receiving state food assistance? And I'll just let Brenda know that we'll follow up with her offline and get that answer out to everybody through the Facebook site. So go ahead, Joe.
Absolutely, sir. And I know there are still several people on the line. We still have over 1,500 people on the line right now. We're coming up on our last 2 or so questions. Just want to thank everybody again. If you're not able to get your question in this evening, just want to let you know you can leave a voicemail at the end of this call. There will be an automated message on how to do that. You can send an email at rick.larsen@mail.house.gov, or you can call our office at 425-252-3188. I'm going to have the next question is going to be from Carrie Stockstill, has a question about loved ones who are incarcerated. Carrie, you are live.
Hi, thank you. So I have my only child, incarcerated in Shelton at WCC. He's supposed to be transferred to his home prison in a few weeks, which is Monroe. And they've already had 2 positive guards, and I heard there's 2 inmates that are in quarantine right now. I also heard that another guard or staff at WCC was tested positive Saturday. So my question is what are we doing to protect our loved ones that are incarcerated? Are they going to start implementing the rapid test for new inmates to each facility, or are they going to maybe stop all transfers to protect and keep the inmates where they're at, so that way new inmates don't spread the virus to other inmates coming from other facilities? And if they do get sick, is somebody going to notify their family that they're sick?
This is Rick Larsen. Thanks for the question. I don't have an answer for you, but what I will do is contact the governor's office, and they'll probably put us in touch with the Department of Corrections in our state, and we'll figure that out from the state perspective. At the federal level, we have the same kinds of questions about federal prisons, and about detention of the use of private detention centers for the undocumented immigrant population, and how private prisons and the publicly funded prisons are addressing these very issues. So from the State Department of Corrections perspective, I will try to get an answer, and we'll get back to you. If you could leave your contact info at the email rick.larsen@mail.house.gov. Meanwhile, Dr. Pottinger, what would be the best? What is the public health advice on prison populations?
Thank you for asking. A huge concern for us. It's a very, very significant challenge. Very difficult to do infection control in this population. The setting is just challenging. We are so fortunate in Washington State to have Dr. Lara Strick, who is the infectious disease doctor in charge of corrections ID. She is extremely energetic and interested in this area. I was just discussing the situation with one of the people she's working with a few hours ago. So a very active area. We really take it seriously. Here's the deal. As we said before, this infection should not spread through the air. It really spreads by droplets, and droplets travel about 6 feet. Everything that droplet touches is potentially a source of infection. And so, yes, even in this extremely challenging situation, it is possible to take a lot of countermeasures to try to do some kind of social distancing. It really varies depending on the circumstance. It depends on the exact kind of correctional institution where the population is that we're talking about. I think this is one of the most vulnerable populations and at risk. Many of the people in prison are not over the age of 70, but that is not always true, and so we do take it very seriously. At the moment, I cannot tell you exactly what countermeasures are being deployed at those particular sites. It's just not my particular area, but I would say public health takes it seriously, and you should know that there are some very dedicated and smart people who are really interested in preventing another huge series of outbreaks in these prisons. What we saw in nursing homes is what we do not want to see happen in our prison setting, put it that way.
Yeah. Joe?
Excellent. So we're going to have time for one more question. Again, I want to thank everyone for their patience tonight and for your questions. A lot of great questions. We're going to have, just going to mention, if everyone on the line would like to sign up for Congressman Larsen's e-newsletter, which again is a great way to stay informed as the COVID-19 situation evolves and as we have more information moving forward, please press the number 1 now on your phone. I'm going to bring up the last question, and then I will have instructions on how to, for folks to leave voicemails and to send messages, and then the Congressman Larsen, if you'd just like to give final remarks after that. So our last question is going to come from Chris Lindbergh, a good 2-part question about who should be getting tested and how Congress is helping out. But Chris, I will prompt you now. You are live to ask the question.
Hi, Congressman Larsen and Doctor. Thanks for taking my call. So 2-part question for the doctor, and then 1 question for Congressman Larsen. The question for the doctor is, I keep reading that you shouldn't worry about getting tested. That's not what people should be doing right now. You only need to get tested if you're really sick and go into the hospital. And I do agree with the social distancing and all of those methods, but it just seems like it's don't we need to know in the general population how many people have been affected by this, and what if there is a mutation in it? I mean, it just seems like to say people shouldn't be getting tested is, I don't understand that. The other part of that testing question is, I believe I was hearing the president's press conference today talking about personal tests where you could test yourself. And is that really going to be happening? And is that a good way to do that? The question for Rick is, what is going to happen with Congress? I came on the call a little bit late. I don't know if you addressed this, but are we going to get some help? Are we going to get something through Congress? Because what I keep seeing is that, you know, we're just at this loggerheads, and not that I want some of the things that the president is suggesting as far as bailouts to companies and CEOs, but are we going to get something? Thank you for taking the time.
Yeah, and Dr. Pottinger, why don't you address the who should get tested and why don't we test everybody, and the self-test, I guess, maybe the best way to describe it, and I'll take the last part.
Yeah, thank you. So, you know, in the ideal world, we'd love for everybody to be tested so we could really counsel them on the importance of social distancing and to try to reduce the spread. It's about deploying that testing. As we were talking about before, we still have a long way to go to get the test. Although the technology exists, it's about the logistics of getting it done. And so I know there are a lot of people working very hard on that. We had a caller just a short time ago who said in their part of the district they were having trouble getting that test. That's very disheartening to me, and I know it is to the congressman as well. So we are definitely trying to get testing as an option, rapid, accurate testing available to everybody. One solution to that is actually self-testing at home. That's something that I have done. We've done that in my family as well. Not for this particular infection, but for another infection called influenza. My wife diagnosed herself with flu because we had access to the Seattle flu study. You go online, you sign up, they send you a little kit. It's supposed to show up at your door the next day. You swab your nose. Not too unpleasant. It's like a little pipe cleaner that goes in there. You stick it back in the kit, mail it away, and you get your answer. So that is a technology that is being piloted here in Seattle. And in fact, we hope will become available broadly throughout Pacific Northwest and not only in your district. That's happening as we speak. It's very dynamic. That's something that we think can really help to accelerate this process. So it's convenient, it's easy, and yes, it is a reliable way to do it. Now, the turnaround time is a couple of days. It's not point of care. It's not 45 minutes. The reason why we're not telling everybody to line up for a test, whether it's a one-day or a 45-minute test, it's just that we're trying to prioritize those people who are the most sick, who are the most vulnerable, and the people coming to our hospital. As our test capacity builds up, then I think we'll be able to loosen those guidelines and say anybody who wants to be tested should. As I mentioned before, unfortunately, we do not have a specific treatment for this virus. And if we did, I think testing for everybody would be much, much more important. Because this best way to treat is supportive care, take care of yourself at home, having that information right away for many of the people with coronavirus probably will not change their management at home. But I'm hopeful that we'll get more information on this topic, and I appreciate your question. Let's all stay tuned as things progress.
Yeah, and then I'll answer the other question. I would note that also on Facebook, Sean O'Gara, Mike Kersey on homelessness. Yes, I am listening to you, Mike, and we're not going to get to your question, but you will get an answer. Garth Pierre, Sharon Gunn, Melissa Martini, you will all get answers, and I'm sorry we couldn't get to you tonight. But the last part of the question from the caller had to do with Congress, and it's probably a great way to end. I'd say right now the Senate and the House are a bit at loggerheads, but I will also make a wild prediction that we will come together on a final resolution. And someone had asked me where I physically am right now. I'm in Everett, and at some point I expect to be flying back to Washington, D.C. in order to vote on a much larger economic disaster relief package. I would note the last two packages, the public health package from about 12, 14 days ago, and the package last week, strong bipartisan support for both. And I would expect there'll be bipartisan support as well when we come to resolution. The Senate is taking a different path. There are no strings attached to the money they want to give to companies. I think a lesson we learned in 2008 is that it is we can put strings on these dollars in order to be sure that workers are protected and that taxpayers themselves get paid back, and that's what we're trying to do in the House version. The Senate version does provide some help for some workers. In the House version, we go farther by supporting students who, you're supposed to be in class in school to get your student loan or to have your grant. Well, a lot of these students are now doing online school for college. Our veterans who are using the GI Bill, we want to be sure they continue to use their GI Bill benefits for their education as well. We want to address that. We want to address first responders. We want to address the pressure it's going to put on state and local government budgets. And we want to be sure that workers are protected, that there are no undue wholesale firings or restructuring of companies that put workers at risk when, frankly, this could be a long time to come, a long time, or it could be a much shorter time than we expect because we're all doing the right things on social distancing and other things. But we need to get to the other side of COVID-19, and it's going to require, I think, a bigger package than the Senate has provided. The House is a bigger package. This is a very fast and deep hit to the U.S. economy, and that includes us here in the Pacific Northwest. So I just want to assure people that we are going to get this done, and it's going to look a lot like the classic sausage making and legislating. You may not like how it looks, how we're going about it, but I look forward to the result because I think we'll probably get there in a timely fashion and help this economy while we're all doing our own part too on social distancing, including I think someone told me to mention washing hands, including washing your hands. So it's not just social distancing, it's washing your hands, sing happy birthday twice. My wife says that everyone in America is really good at rinsing their hands. We're not very good at washing our hands. She's right. We run water over our hands and we call that washing it. It isn't. We need to use soap. Keep your hands clean. So with that, Dr. Pottinger, I am going to wrap this up tonight after my lecture on how to wash your hands for everybody, if I can find the page I'm supposed to read from. So I want to end tonight by thanking Dr. Pottinger from the University of Washington. Thanks for coming on tonight and being with us the entire time and answering the questions that we had tonight about COVID-19. Dr. Pottinger, did you have anything that you that you yourself wanted to say at the end?
Yeah, I just wanted to thank you folks all for listening and joining, and totally support exactly what you said about keeping the hands clean. That's excellent. Soap and water. The 2 happy birthdays. I like Twinkle Twinkle Little Star. That's also another way to do it. Listen, we can do this. We can get through this. If we all take care of ourselves, that means we're taking care of each other. I know some people don't take this as a serious threat. It is a very serious threat, both to our economy and to our health and safety. So thanks to every one of you for taking care of yourselves, paying it forward, and for your interest in this important topic.
Thanks a lot, Dr. Pottinger, and I want to thank everyone for participating, being on the line, and we'll get back to you all. And Joe, I'll turn it over to you for closing comments.
Absolutely. Thank you, Congressman Larsen, and thank you, Dr. Pottinger, for joining the call tonight. I want to thank every one of the more than 8,500 people who at least called in or logged in at one point. We thank you so much and hope this was informative. And and we appreciate the opportunity to speak directly with you and answer your questions. Like I mentioned earlier, if you were not able to get your question in this evening, you can leave a voicemail after this call. There will be instructions. You can also send an email to rick.larsen@mail.house.gov. You can also call our office, 425-252-3188. I also encourage you to follow Congressman Larsen on Facebook. That's Congressman Rick Larsen. On Twitter, @Rep Rick Larsen, and Rep Rick Larsen on Instagram. And also, one more time, before the end of this call, if you want to press 1 to be added to our e-newsletter, it's a good way to stay up to date and get information from the Congressman moving forward. But again, I want to thank everyone for joining us, and we hope to talk to you soon. Have a great night.
Thank you.